How do you mitigate fiscal and physical burnout from going to various appointments, especially with needing to be extra cautious with the ongoing pandemic, i.e. paying for Uber, Lyft, car rentals to and from appointments, extraneous appointments that go nowhere, or wait lists that take a considerable amount of time, meaning that other costs are incurred? It seems that healthcare costs have increased significantly since 2020, as has the physical burden of these extra steps and protracted treatment plans, and I'm curious about what can be done to remedy and or alleviate these burdens.
One aspect is documentate. So one aspect is when they're booking appointments, I try to separate them out to avoid the physical pressures. And if it is multiple appointments scheduled too close together, I arrange for someone to assist me with those. And the financial aspect is I keep track of it in the same booking calendar. So with it, if I'm going to Toronto and I'm seeing two different doctors, I'm putting in the mileage in my phone in the appointment. So when I go get around to tax time, I have that information. And I have a box that I keep beside my bedside table that I put all of the medical receipts in. So all the parking stubs, the meal receipts, etc. And the reason for that is I've been audited by Revenue Canada 4 times for my medical expenses. Anytime you're over $10,000, they're auditing you. So with my medications, my husband's drug plan puts out about $26,000 a year, and out of pocket we're about another $10,000 to $15,000, not counting medical renovations. So with it, having the paperwork that goes with it, and so I've had where the occupational therapist did the assessment for me for my new power chair, which I'm sitting in, and with it I got them to also assess my bathroom for accessibility, and they deemed it was unsafe for me to have a shower in there on my own because the damage I did to my own spinal cord by just some reason just washing my lower back. I managed to pop 2 discs. Who knew? And so with it having that documentation, I provided that to Revenue Canada with all the renovation construction material receipts, and suddenly I'm not being audited anymore. But it's sad that we're the ones having to provide all the proof and the resources, and when we're already struggling with brain fog, pain, etc. So that's one of the things I do is I keep track of it in that, so that I can just go back and go through the calendar and pull all that information. So with it, oh, I forgot I went to see this doctor that was in Oakville. Well, I didn't record the mileage. So then I do a Google Calendar, print it off and put it in my tax box. Just so that I can kind of manage. So when I get to that time of year, I have it to pull. The other thing is bringing a friend, because with it, the toll is too much. So I have a friend that will drive for me. If I can get the half an hour to her house, she'll drive the rest of the way to Toronto for me. I have a couple of friends that if I get to my appointments and I can't get home because I'm in too much pain, I know I got a bed that I can crash in, versus trying to make the 1.5 to 2 hour drive home. And with it, it's that what if and planning ahead. And sadly, it can send us down the rabbit hole of worst case scenario, and can sometimes be too hard on our health. Does that make sense? So it's trying to find that balance, because you can plan, you can have plan A, plan B, plan C, but then there's times you have to say, sorry, I can't afford to go to all these appointments. Can this doctor provide me a virtual appointment? Can I get a telephone appointment instead? I've had to do that with some practitioners, and I point out I'm traveling an 1.5 for a 15-minute appointment with you, and then I have another 1.5 back. and I'm having a bad pain day, I don't want to miss the appointment. It's just the fact you can't travel. So looking at, can you do it through OTN? Can I do it by phone? Can I do a video from home? And just trying to find the right balance, and what's a balance for you. So sometimes I'll push myself for a whole week, but then I put it in my calendar. I'm going to be kind to myself on the following week. I don't book stuff in, or if I'm booking stuff in, it's stuff that brings me joy so I can recharge my batteries. Hope that helps.
I can attest to Tammy's pacing herself and then being resilient, because after she made that presentation video, her lift on her truck broke. So she did not, and she's still trying to problem solve around that. But using your wheels to get around locally is what you said in your presentation, and you're doing it now. So
so my wheelchair lift broke on my truck, and so I can't bring my wheelchair with me. So today I had my injection. I drove myself. I had to use my forearm crutches for the appointment and back out. But it was, the nice thing was, when I got home, my new lift that my husband was able to buy used from Edmonton had been delivered by the delivery service. So it's getting installed this weekend. So it's handy to find someone that's handy, that can do repairs and figure stuff out for you as well, to help you problem solve. Because it's been the saving grace, because he's been able to MacGyver new straps, do repairs. He managed to 3D print me a new armrest for my wheelchair, versus paying another $200 for another armrest. I paid $25 for the plastic, and he found the mold online. So public libraries have 3D printers. So
wow.
with it, if you can find the file online, go to your public library, and with your library card, you could actually book time, and you just pay for the materials, and you can print your own replacement part if you need it, for the cost for library membership and supplies.
I think the length of Tammy's presentation and the volume of what she put into it just shows what you know, all the things you need to think about. And really, for individuals living with chronic needs, it's a full-time job. So it, as you said, you have your ambassadors, you have your caregivers, your care support people. Those are the ones that are going to be able to step up when you can't advocate and keep the ball rolling, because it's very hard. It's a lot of work.
It is. And with it, my job was navigating the healthcare system. I help clients navigate. That was what I did until my SI joint dislocated for the first time, and it blacked out, and the hospital, some reason, thought I was there for ED, not EDS. And the doctor came into my exam room and asked me where I was in my transition, because he thought I was there for erectile dysfunction. You know, I can laugh at it now. I never even got an x-ray. So didn't even know what was going on. And it took, you know, another couple of years before we realized that it was contributing to that spinal cord injury. And having people that can advocate and help you communicate. And when you're the one that's in this position, you can't always do it because the emotions run high. And we have some hope that finally we're getting in to see the specialists, and they're going to be able to help us. And I accept the practitioners that say, I'm sorry, I don't know how EDS affects the GI system. And I say, do you want some journal articles, medical journal articles? And they say, sure. And we'll have another appointment in 2 weeks and discuss and come up with a plan. And the practitioner that did that for me, I have all the respect in the world for.
Yeah.
So with that, and then sharing that information about the ones that are willing to learn, and the ones that are willing to assist us in the journey. important.
No, exactly. So, you know, overwhelmed or not feeling well, or even anxious, like, you know,
Yes.
you mentioned going to that appointment finally, and then that can be, you know, put you off your mark. So,
Yeah.
you know, we do encourage to have your ambassadors with you when you go. Hear people that can step up, or you can even just say, these are my notes. I'm just going to have to let you carry it for me. So that's great.
Yeah, the appointment, having the doctor update that I keep on my desktop has been key, because when I've gone and they can see that, oh, you've been dealing with that scar tissue that's been tearing open now for 3 months. Maybe we need to refer you to a dermatologist to look at, do we need to stitch it? Is there another way we should be caring for this? Where that was my priority. My priority was, I'm here because I'm having this other issue.
Yeah.
So having those records is helpful as well.
Excellent. And obviously a practitioner that's going to listen to the patient's priority, which is the number one thing.
Yes.
So I don't think we have any, we don't have any more questions in the chat. So thanks again, Tammy.